Amazing. So, for our next session, the planetary health is human health. As we grapple with the pandemic, we see that the health of people and the planet is often upheld and protected by women. How do we draw on women's leadership to ensure that a green future is also a healthy and equitable one? To discuss these questions, please welcome onto the stage Sophie Lambin, CEO from Kite Insights, which provides research and insights on the issues that matter most to our economy and society. And, very importantly, Sophie is also the editorial partner of the Women's Forum. She also gets everything done. Here she is, Sophie Lambin and her speakers.
Thank you very much, Tanya. What an incredible level of energy you have, and I think we all need it. This is the one before last session before lunch, so thank you for hanging in there for what is a very important conversation. So, planetary health is human health. I know that this year's global meeting has a lot of very interesting sessions, but I have to say, and I should probably not have a favorite considering my role, but I do like this one very much because it is often at the intersection of knotty issues that we found the greatest potential for interesting solutions. And I have three extraordinary speakers with me today to tackle that nexus of planetary and human health. Joining us remotely is Dr. Neira. Hello, Maria. Can you hear us?
Hello, my dear. How are you? So
I'm
nice
very well,
thank you.
Thank you. And sorry we can't see you. I understand your video is not great, but we'll hear your energy through your voice. So Maria is the director of the Department of Public Health and Environment at the World Health Organization. And the WHO, you might have heard about that organization in the last 18 months. She's really a leading global voice on climate and health, calling on government and other stakeholders to really act together to protect people from the biggest threat of human health we face, climate change. Welcome, Maria. I'm then joined by Ulrike Decoene, who is a group head of communication, brand, and corporate responsibility at AXA Group, and a strong advocate of bringing a gender lens to the issues of access to health, amongst others. Ulrike is also a long-standing supporter and partner of the Women's Forum. And last but not least, to my right, I have Leah Thomas. Leah is an intersectional environmental activist and eco-communicator based in Southern California. She's passionate about advocating for and exploring the relationship between social justice and environmentalism, and is the founder of Intersectional Environmentalist platform. Welcome to the three of you. Earlier this week, we woke up to the upsetting news of dangerously high level of pollution in New Delhi. And it's really heartbreaking to accept that this is the new normal for children, for families, for communities around the world. In September of this year, the WHO declared that 4.2 million deaths every year occur as a result of exposure to air pollution. 4.2 million deaths per year. So acting on health and climate simultaneously has never been more urgent. I was in Glasgow last year with Leah, amongst others, and Maria as well, and it's the first time, in fact, that the COP had a health pavilion in the Blue Zone, which really signified that that nexus between health and climate is really coming to the fore. And our joint experience of the pandemic and the growing impacts of climate change has meant that we are really starting to see the climate crisis as a health crisis. The more polluted the air becomes, the more our hearts and lungs risk disease and long-term damage. The bigger the threat to future diversity loss and pandemics, the more vulnerable our healthcare system and economies become. But we can't talk about resilience if we're leaving people behind. So we are faced now with a ultimate opportunity for implementing long-term, truly inclusive climate solution. And the questions are, who have we been leaving behind? And how can improving access to health for diverse groups of people contribute directly to the best climate solutions? So at this point, I'd like to turn to my speakers with some initial questions. And maybe, Maria, I will start with you. If you could tell us as to why, in your view, planetary health and human health are so deeply connected.
Thank you, Sophie. And I have to say, I'm so jealous. It looks like you have such a positive energy, such an environment there. I feel really bad not to be able to join you. I'm in Madrid at the Complutense, and we are just celebrating a clean air forum where we are fighting for clean air. So it's very relevant to what you are talking about now. Climate change and pollution and the way we treat our ecosystems are so much connected. No doubt about that. The thing is that, you know, this famous mantra of leaving no one behind. We are leaving millions behind already. And among those millions, most of them are women, because every day they need to collect wood or something to be able to cook or lighten or to heat in their houses. So this is contributing to the household air pollution, killing the 4 millions that you were referring before. The bad news, Sophie, is that there are another 3 millions as well, caused by outdoor air pollution. So in total, we are talking about 7 million deaths caused by air pollution. I think the connection is very clear. If you keep burning fossil fuels, if you keep having all of those bad choices in terms of the way we produce, we consume, we generate our food on a non-sustainable way, our cities continue to be unlivable, and we use energies that are literally polluting and killing us. We are leaving a lot of people behind. So let me start with something very light. We need to take over, Sophie.
Thank you, Maria.
Women need to take over. I see a young woman in this room, and this is my message to you. From here on it, we take over, because we are practical people, we are pragmatic, and we know how to solve problems. So I think it's time for that. Sorry if I put a little bit of provocative sentence here, but I think it's time for it.
Thank you, Maria. I think we can applaud for that provocative suggestion. Thank you, Maria. Ulrike, if I can turn to you. You see human health and climate as sort of two systemic risks that somehow compound each other. Can you share your perspective from, an insurer's point of view?
Of course. Thank you very much. Yes, indeed. I mean, climate and health are two really systemic challenges. I think we knew that for climate. I think we have really discovered it for health with the COVID crisis. I don't think that we had expected a global pandemic to really disrupt to that extent our lives, our economies, societies, and to have all those consequences. So clearly this has, we've really changed in the way we look at those two risks. As Maria said, they're intertwined. And I think it was the head of the WHO who called climate change the one biggest risk for global health in the years to come. And I think it's also the fact that there is this awareness now and at COP it was very striking, is also because nature, environment and biodiversity have now a big place on the climate agenda. And a lot of those health issues we're talking about are linked to the fact that we are destroying nature, we're destroying the ecosystems that allow us to breathe clean air, to drink safe water, and to thrive on a health plan. I would say the third element that really makes those two challenges something we want to look at together is the fact that they affect disproportionately the most vulnerable people. I think Audrey mentioned it this morning. I think 70 to 80% of climate migrants are women. And let's not even talk about the price women are paying to the health crisis we've seen, and our CEO Thomas Bubel mentioned it this morning. So really these are risks, and the news actually is we survey every year 20,000 people from the global population in 15 countries and more or less 3,500 risk experts. And I can tell you for the past 5 years, climate and health have been on the very top of the agenda in many countries. So it's a global concern. Maybe to end on a bit slightly positive note, if I may, I do think that COVID has really changed the mindset of, you know, a lot of decision makers, of corporates, because we've seen the extent to which those risks can really challenge everything from, you know, corporate action to democracy. And I think the awareness that we need to find solutions to these risks, having a very holistic view, working together, building up resilience, I think is now very, very, you know, much higher on the agenda. And I do think that, and maybe we will discuss that, if COP for me was, I have more positive takeaways, this global conscience that is arising now is also due to what we've been through with the COVID pandemic. So really, I see those two challenges as being very, very similar.
Thank you. And we'll come to discuss how that double lens is actually helpful in the way we design solutions. But first I go to you, Leah. You are bringing that intersection lens in everything you're doing in the climate space. So maybe share a few of your thoughts on that intersection.
Well, the climate crisis is an intersectional issue, so therefore our solution should be intersectional. And when you're looking at who is impacted by the climate crisis the most, like you mentioned earlier, vulnerable communities are impacted the most. And if we take it to my hometown of Los Angeles in California, the data shows that 70% of African Americans are living in communities that are in violation of federal air quality standards. And when you start to break down the data and the statistics about who is exposed to pollution, who lives closest to toxic waste sites and facilities, time and time again, we see that identity is a key indicator. So by ignoring identity and how that's intertwined with who is experiencing the climate crisis the most, then we aren't getting complete intersectional solutions. So that's why my work talks about intersectional environmentalism. I know that's a very lengthy word, it's about 12 syllables, but really it means not missing any of the nuance when we're talking about health and environment, and instead linking those two things together so we can have the most complete solution and answers that are helping the most vulnerable communities.
Thank you, Leah. And maybe we can move back to that. I think it's a remarkable work you do, and the way you articulate it as well as, you know, we need to look at those solutions through that same lens, recognizing of that domino effect that it has. So maybe can you talk through some of the ways in which you are thinking about deploying inclusive solutions and give us some examples to bring that to life? And then, Maria, I'd like to bring you back in a conversation on that solutions point as well. But over to you first.
I often start with resources because environmental justice and climate justice-based work unfortunately receives around 2% of all philanthropic funding that goes to environmental work. So that's where I usually start. There are a lot of BIPOC, which is Black, Indigenous, people of color led organizations that are addressing this intersection. However, they don't have funding and resources. And we need that funding to be able to produce even more data and do so much more research that will show those intersections between health and environment and identity. So that's what I'm advocating for right now, just really ensuring that the people who are doing the work, the on-the-ground organizers that are advocating for climate justice, the incredible students that are trying so hard to pave the way for intersectional environmental health is what they're calling it, which again, more syllables, but amazing, so that they have a future and they have the resources to do this much needed work.
Thank you. Maria, can I bring you into the conversation? How do we design inclusive solutions? Do we have the data, the funding? What is your point of view at the WHO?
Well, Sophie, we never had so much evidence, scientific evidence, to demonstrate how climate change is affecting our health, how air pollution is affecting our health, how destroying the environment is affecting our health. I think if we are not moving faster cannot be make responsible the lack of data. We have data, we know the bad quality of air in our cities. Now, the changes, the transitions, and the transformations we need to now achieve are very much related to how we interact with our ecosystems. So we need to influence to stop this deforestation, aggressive agricultural practices, the way we produce our food system, I mean, the way we are more sustainable in the way we produce our food. We need to do a healthy transformation at the urban level. So we need to change our cities, and we need to make sure that we will reduce the exposure of air pollution, having more energy efficiency. All of this will require so many cultural society changes that somehow we'll need a very strong leadership, because the health arguments are there, and we can quantify the health benefits of any of those transformations or transitions that we need to do. Fundamentally three: the healthy urban transition, the healthy energy transition. We need to move to more sustainable, renewable sources of energy, because this is killing us. And on that, I have hope. The day I met with Moms for Clean Air, or groups of mothers fighting for clean air because their children are asthmatic, for instance, that day I realized that this battle is one that we are going to win.
Thank you, Maria. And yes,
when you have moms fighting for the health of their children, nothing will be more.
Your voice is cutting out a little bit, Maria. So what I'm hearing you saying is that the grassroots movement
powerful than that, and the motivation will be very strong. We need to use legislation as well. I think the case of Ella is very strong.
Thank you, Maria. I think you were saying two things. On one hand, that the conversation is really happening at a grassroots level, with mothers fighting for clean air for their children, which sounds pretty fundamental, plus regulation. And I think, Maria, you are really pushing this agenda. Your communication was a little bit patchy, so I'll come back to you in a minute. But maybe I come back to you, Ulrike. Your views on solution, what do you see emerging from the lens of your industry in terms of solutions that are intersectional but also inclusive?
Yeah, I think the first important, what is really key for me is that one challenge doesn't make us forget the other challenge. So the risk was during the pandemic that we would put the climate action on the side and say, let's focus everything. And there was some criticism, you know, to public action for a while on that. And I think it didn't happen that way in a sense, because if you look, for example, at European level, very quickly, there was a lot of focus also on rebuilding, build back better in all the different senses. So at AXA as well, we were very, of course, focused as every organization on navigating the crisis, making sure everybody would be safe, we could serve our customers. But we also did decide to accelerate on the climate agenda, because there is this awareness that, you know, the climate crisis might just be a repetition in worse from what we've seen. And so we have, we really worked a lot to be able to announce a couple of weeks ago, additional actions on protecting forests, which Maria mentioned is so critical, which means not ensuring some sort of, agri-food industries, or making sure that we do not bring any support to all those activities which have a bad impact on deforestation. We worked on being able to retrieve a bit from the oil and gas industry as well in a responsible manner. So I think that from an organizational point of view has really changed in the fact that we see those two things really together. And I know that for people working in the sustainability space, that conviction that you cannot separate the E, the S, and the G from ESG, that you have to act on the three levels together, is really key. And maybe a last point, just food for thought, but I think a lot of what we're saying basically, and if I think back to COP and and how the financial sector was present at the second day of the COP, putting all that money on the table, saying we have organizations that represent several thousands of trillions of funding, which is available because those organizations have committed to net zero. And then the criticism was, yeah, but how do you explain that there are so many, as you say, vulnerable communities without any solution available? So I think the challenge that we have both on the health and climate side today is how we bring the macro action that governments, private sector are able to do, which is shifting funding, like big chunks of money, with the solutions which are very granular, which need to embed the local affected communities, which have to be extremely concrete. And so I think this is the gap that is frustrating a lot of people today. So you see the awareness, you see the availability of funding, you see people ready to take action, but somehow it's not getting where it should be getting. And I think that's on the two elements, when we think about building solutions, I think that's really what we have to have in mind.
And in a way, the investment is designed with those communities and in mind. So, Leah, I come to you now. We talk about how women are disproportionately impacted usually by those issues. Maria set the scene by saying women should take over. Can you give us your perspective on what do you see the role of women being in that context, in that nexus? And do you see leadership? Because there is lots of evidence of women being more acutely aware and more willing to take action on those issues. So maybe if you can comment on that, and then I'll go back to Maria and Ulrike.
Absolutely, and I had one other note about the presence of data with environmental justice and its intersections with identity. I wanted to mention that there are so many incredible organizations that are collecting data on this subject. In fact, since the 80s, there's been environmental justice research from people like the father of environmental justice, Dr. Robert Bullard. However, that information is not getting disseminated to the everyday person. It's kind of being gatekept in academic institutions and government institutions, and it's kind of a bit frustrating because when I go back to my hometown, which is actually St. Louis, Missouri, and people think, okay, having asthma in my community is normal. It's hereditary. But they're shocked when they learn that their air pollution in their area is twice the national average and all of these other things. So I wanted to make that point that while we might have the data, this information cannot be gatekept. It needs to be shared with the everyday person. It needs to be as accessible as possible, because that way we'll have more people who are stewards for both climate and the environment. But back to your question, which was...
It's a very important clarification, I think, that the data needs to be accessible in order for everyone to be able to act on it.
Absolutely. And if you use social media, it can also be designed with really great designs, but that's a conversation for another day. But I think women are such incredible leaders in the climate movement and have been for quite some time. Even if you look at the climate strikes and so many other incredible movements that are happening, it's mostly women, which is amazing. And as was mentioned earlier, women are more impacted by the impacts of climate change, so should be present when it comes to thinking of the solutions that are available for the climate crisis. So.
And do you think that representation, and that's open to all of you, Maria, Ulrike, do you think, considering the critical role of women, do you think their access to data, finance, and their presence around the table is sufficient?
Is that really a question, Sophie?
Yeah, I was going to say, this is not a leading question, by the way.
No, I mean, the obvious answer is no, although sustainability is actually a space where you have a lot of women, at least in the private sector, which makes me very happy. If you look at the health space, which we know pretty well, and it has been said a lot, 3/4, I think, of the healthcare workers, frontline workers are women. And if you look at the, I would say, top healthcare companies, probably very, very little of them are managed by women. So clearly, having women at the table is critical for all those challenges. The funding, as well as you said, so on our side, what we're trying to do is what I like about these challenges is that they force you to innovate as a company, to step out of your comfort zone. And it's true, we have started to take the women lens when it comes to our insurance products for a couple of years, as you know, developing when it comes to health, for example, what can we do that gives, that really meets the needs. And very often those needs are information, about prevention, about being able to talk openly about some topics with your advisors. And we're introducing that actually in the investment part, because as insurers we can act through both with both arms. And the impact fund on health that Thomas Buble announced this morning, that we're putting out there with 300 million euros, which is really going to go to very, very small, very concrete healthcare projects, is going to have a women lens with a focus on maternal health. And to be fair, this is something our experts, who are excellent and brilliant, are learning, and I think it's quite exciting. But it's there's a lot of work still to do.
Education. I mean, I think it's bringing that gender lens in everything we do, and those investment is a function of representation, education. We are also working with the WHO. I think Maria lines dropped on. They produce a manifesto on a green and healthy recovery, and with the Women's Forum and the Women for Health Daring Circle, we are systematically looking at how can we bring a gender lens to this. I'm going to turn to the audience to ask a few questions. So if you can prepare yourself to ask them. But before that, maybe Leah, if I go to you, what is your expectations of the public sector, the private sector, to better support your community, the woman that you think whose leadership is so critical to lead that kind of action? What is your ask?
My ask is definitely disseminating this information to the everyday person, because like I mentioned earlier, I think with that knowledge, with that education about environmental justice, then people will be able to take informed action and become environmental justice advocates. So just really ensuring that this information is disseminated to the everyday person, because I think if people knew how bad it is, we would have so many more climate champions out there.
Great, thank you. So I will take 3 questions. If anyone wants to raise their arm, we have people with mics around. Any questions? Someone? Okay, thank you. I like you very much. If you can bring a mic. Thank you.
Thank you. I have a question for Leah. Just to expand on that point that you've just made a little bit more, what would you say would be one of the best methods of getting that information out there, and particularly to schools, to young children? And having done all of this work, you probably have lots of ideas on how we can do this.
Thank you. Before you answer, Leah, let me just take maybe another 2 questions. Yes, here at the front. Thank you. You remember that, yeah?
Okay.
Thank you. My question is probably a little bit more provocative with COP26 that we've just seen. We see a lot of companies now privately that are making a lot of effort and investment. I just wonder, how do these private companies can also push more governments to do similarly? Because we're asking a lot the private sector, but it feels today to me that governments may not be following as much.
Great, thank you.
Both of you.
And lastly, at the back, thank you.
Yeah, hi, this is a question for Leah. I too would be interested to know a little bit more specifically, what kinds of information are you interested in, especially with respect to the intersectionality between gender, race at the community level?
Great, thank you. I don't know if we can bring Maria back online, because I'd love for her to pick up the question of expectations of government, because she's definitely pushing hard on that. But Leah, Ulrike, feel free to both answer the questions.
So I studied environmental science and policy when I was in school, and I remember learning all this information and wanting to come home back to St. Louis and just spew it at people and say, okay, so you probably care about the earth now, and kind of having them say like, okay, do I get straws? What do I do? What's going on? And I realized that a lot of environmental science language was just so inaccessible. So that's why I started with what I call eco-communications, trying to synthesize environmental justice data in a way that is accessible to the everyday person. And it's kind of an experiment figuring out what works, but I started Intersectional Environmentalist last year with the goal of reaching as many people as possible and utilizing social media. A lot of academic institutions, I don't know why, maybe a little prestigious, are a little so-so when it comes to the legitimacy of using social media. But to me, you can reach billions of people utilizing social media, meeting them where they're at, and there are people using TikTok, creating climate art. And if I can reach more people by synthesizing environmental health information on a graphic that has gradients, and I've tested different designs, it's kind of an experiment, and I found, okay, Gen Z is really into this. This is how we make environmental justice cool, by meeting people where they're at. And also not talking down to students who are utilizing platforms like TikTok to share this information, because that's a step in the right direction. So I would say, as an educator, really meeting your students where they're at. If they're utilizing social media, especially if your students are using social media for climate education, when they could be doing so many other things, and nurture that in them, because I think that communications and art can all be used as a vehicle for positive change. So I'm not sure if that answers your question too much, but I would say really broadening your horizons of where academic reach may be. And the easiest way is just meeting people where they're at on social media and other online platforms.
Thank you, Leah. Ulrike, on the recognition that there's a lot of that is being asked of the private sector, how do you, as a private sector company, interact with government to really create that right environment for action?
Yeah, maybe just first, just building on what you said, Leah, to say that this is also a challenge we're trying to address within our organization. We launched a training on climate, for example. We don't want climate engagement to be an expert kind of thing of 3 people who are we think that everybody in the organization can actually take action and give ideas, and I also think that the education, public education should take this more on board. But to come back to your question, Sophie, it's true. It's not always easy, and it's one of the reasons why I love my job, because I think it's really about helping the organization to grasp all these expectations that are coming on top of just making money, serving your customers, and treating your employees fairly. It's not easy every day, but it's extremely fascinating. I would say there are 2 aspects of it. In Europe, we're actually, and in France especially, there's a lot of new regulation coming, which you might see as a constraint because it makes your life a bit more difficult. But on the other hand, we really need those governments to show us the way. I don't think the private sector should be. The finance sector, for example, should be on his own making decisions about which sector we want to support or not. I mean, we can go to a certain extent, but it needs to be part of a resilience plan that is worked out by the government, also having in mind the challenges we're going to have to make this transition fair, socially speaking, right? So I think, I sort of have two views on that question. I think governmental action is pretty important right now, but it could go one step further to really help make this corporate activism a bit more, straightforward and bring a bit more comfort to private organizations when they are called upon to take those actions on climate, on health.
Great, thank you so much for those contributions and this question. So I'm just going to close maybe with a few words of conclusion on really acknowledging that the deeper we understand this connection, the better we can truly develop more inclusive, effective, long-lasting solutions. I think I heard from you, Leah, that we don't just need more data, we need data that is accessible and that is made accessible to different audiences, including through corporate training, as you were saying, Ulrike. We need more diverse decision-making, and that means build a bigger table. Making the table accessible at a local level, at a national level, but bringing indigenous leaders, frontline healthcare workers, climate workers, to really get them to contribute to climate health policies and institutions. So diversify the contribution in the decision making, and then more capital and investment. Make sure the funding goes to where it's needed, and bringing that gender lens as a key enabler of getting the right kind of decisions and solutions. So with that, I want to thank you, dear panelists, and you, audience. Thank you for your questions and for your participation. One more session before the end of lunch, so thank you very much for your presence.